A very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Happy new month. This is the very first Wednesday of August. It's such a blessing to be here. Na ukisikia August unajua sasa mwaka inaenda kuisha. Or is that so for most of us? You know, because August is usually more of like the last holiday before the December holiday. So it looks like the year is already coming to an end. Karibu sana, thank you so much for being here. Hello to all our students. How are you? Najua mko nyumbani. And I know this should be like the first show for Afya Clinic that you're getting for this holiday. Thank you so much for being here. Welcome. We are happy to have you at home and enjoy your holiday. Okay? So karibu sana. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is none other than Afya Clinic, where we talk about everything health. We simplify everything, even the heavy topics, like the one that we'll be having today. And we simplify all that to make sure that you just get to understand, and just remove the stigma that is usually there in such diseases. You know, we say that each and every time we're having discussions, we're not here to make you realize unajua sasa hii ni kubwa sana. No, we're here to do more of sensitization, to make you understand what that looks like, and to help you know that there's always a cure to all these. And you always say that kama ni ugonjwa yenye you can prevent, it's even better, because you say that prevention is better than cure. Sawa sawa. So we'll be telling you what we'll be talking about today. But before that, karibu sana. Thank you so much for being here. I'm your host, Rachel Kahugu, and we'll be here up to 10 in the a.m. Today, we'll be happy to hear from you. I want to know how you're doing. How's your month going so far? What are you thanking God for? Our numbers are very open. That is 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. And of course, you're live on Facebook on MBCI TV Facebook page. You're live on YouTube on MBCI TV official YouTube page. Ukienda pale utaanza kupata ujumbe wako loud and clear on the comment section. But of course, on all social media pages, ukienda pale at Rachel Kahugu. I'll be happy to hear from you. I'll be able to get your feedback. So karibu sana to Afya Clinic. Now today we'll be talking about infertility. Infertility is one of the very heavy topics that we talk about, and you'll be getting to know why it's very heavy. And I know this affects a lot of people, and it comes with a lot of emotions, I know, especially for couples, and we'll be getting to just unpack to know what are the causes, what is the treatment, and how to go about it. And we have the best gynecologists who help us unpack this particular discussion. And that is Dr. Emmanuel Wekesa. I think the last time he was here should be December last year. Yeah?
Yeah, around there.
Yeah, around December 2024. And so we'll be having this amazing discussion, and I know that it will be an amazing discussion for you as well. But for you to just to get to understand who Dr. Emmanuel Wekesa is, let's get the guest intro. Good morning and welcome to Afya Clinic, where we bring you insightful conversations that promote your health and your well-being. Today, we are honored to be joined by Dr. Emmanuel Wekesa, a consultant obstetrician and gynecologist with over 6 years of hands-on experience in women's health. Trained at the prestigious University of Nairobi, Dr. Wekesa holds a Master of Medicine in Obstetrics and Gynecology. His dedication to providing compassionate and expert care has made him a trusted name in the field. Outside of his medical practice, Dr. Wekesa enjoys adventurous road trips and connecting with nature, a refreshing balance that enhances his holistic approach to patient care. Today, we are diving into a deeply important topic, infertility. We'll explore its causes, treatment options, and emotional journey that many couples face. Stay with us for this insightful discussion. I'm your host, Rachel Kahugu. Perfect. So that's the doctor that you're having today. Karibu sana.
Asante.
How have you been?
I've been okay.
Yeah? How's your year going? Nitakwambia Happy New Year, because I'm so tulionana last year, on air.
The year is nice so far. The year is nice.
Amazing.
Yeah.
It's August. August is one of my favorite months. How is it going so far?
Is it your birthday month?
No, it's not. My birthday month is April. So this is my second favorite. My favorite is April.
Okay.
Yeah.
Okay.
How about yours? Is it a normal thing to have favorite months? No?
It's normal. I like December because it's full of holidays.
Ah, okay. Makes sense. Karibu sana to Afya Clinic.
Thank you.
We are happy to have you. So since the last time you were here was last year, December, I know we have members of this family of Afya Clinic who are seeing you for the very first time.
Yes.
So please, because of that, please introduce yourself once again. I know that you've already had the guest profile, but please introduce yourself, say hi to them, and then you can get started.
Yeah, so I'm Dr. Wekesa. I'm a consultant obstetrician gynecologist based in Nakuru. I'm based at Infertility Hub on 5th floor.
Yeah.
But I also work with the Nakuru County government.
Amazing.
Yes.
Perfect.
Yeah.
Now, you said you are located at Infertility Hub. It's
Yes.
Preston?
Yeah, so the place is called Preston Medical Center on 5th floor, yes.
Okay.
Yeah.
So what are the services that you offer there?
We offer a number of services.
Yeah.
We have consultation services where we have various specialists, like I'm a specialist gynecologist. We have other specialties. We have a pediatrician, we have a surgeon, general surgeon, we have an orthopedic surgeon, a pediatric surgeon, a psychiatrist, a counseling psychologist, and we also have a physician.
Okay.
Yeah, even an ENT surgeon.
Okay.
We also have laboratory services, pharmacy services, ultrasound, immunization, minor surgeries. Those
So
are
everything
some of
that
the
you need,
services we have.
literally.
Basically, almost all outpatient services that you need, we have them.
Okay.
Yeah.
Perfect. Now, as you've said, you're a gynecologist.
Yes.
And I know that today we'll be talking about infertility.
Yes.
But apart from infertility, or rather handling infertility, what does a gynecologist do for the people who are hearing this word, a gynecologist, for the very first time? Gynecologist ni nani? I'm a gyna.
Okay, basically, we combine like two related fields.
Yeah.
We have obstetrics and gynecology. So obstetrics has something to do with care of pregnancy and childbirth. And then gynecology is dealing with women's reproductive health issues.
Okay.
Yes.
Okay, perfect.
So so usually one is an obstetrician gynecologist. So you handle both pregnancy and female reproductive medical issues.
Okay.
Yeah.
Perfect. Now today we're talking about infertility.
Yes.
And as you said, is that infertility is one of the very heavy topics. To talk about.
Yeah.
But let's just start by unpacking what infertility is. In layman's language, infertility meaning?
Okay, infertility, we talk about someone who has infertility when a couple have tried to conceive for at least 1 year of unprotected coitus without success.
Okay.
Like if a couple tries to, they're having unprotected coitus for 1 year and they're not able to get pregnant and give birth to a live child, then we say they have an infertility issue. Yeah.
Okay. Why 1 year?
1 year because most, you need time. Okay, let me explain this because you need, ordinarily in one cycle, a woman, only 20% of women are able to conceive in one cycle.
Okay.
So on average...
20% is more, gosh.
Yes.
Yeah.
Human reproduction is quite inefficient.
Yeah.
It's only 20%. In one cycle, the chances of a woman conceiving is only 20%. On average, it takes about 4 months for a woman to conceive when they have unprotected coitus.
Okay.
So 1 year, because it takes time for someone to conceive because of other natural factors that come in.
Yeah.
And so someone needs time for them to be able to conceive.
Okay.
So for example, if a couple has not conceived for 2 months, it doesn't mean they have an infertility issue. Remember, the chance of conceiving in just 1 month is only 20%.
Yeah.
But given time, this couple will be able to conceive.
Okay.
So before we conclude that you have infertility issue, we need to give a couple time.
Okay.
So that they are able now to conceive. But after 1 year, they have not conceived, we consider that those couples are likely to have infertility.
Okay. And I love the fact that you've used the word likely.
Yes.
Yeah.
Yes.
So we'll be talking about mainly infertility.
Yes.
But apart from infertility, what could be the other issues that would cause this couple not to conceive in 1 year?
Okay, one is that, okay, they can have infertility, and we have various causes of infertility. Maybe we shall talk about them.
Yeah.
But another thing that can make the couple not to conceive in that 1 year is maybe they're not having optimal, coitus. They are not having regular coitus as it should be.
Yeah.
And that's one of the major reasons. In a modern world, you have maybe a woman is here in Nakuru, the man is in Nairobi because of work and other things.
Yeah.
So if they're only able to meet once in a month, that is not good enough for them to be able to conceive.
Okay.
So that is one of the challenges that we currently have.
Okay.
So the reason is not because they are having infertility, but the reason is because they are not meeting enough times to be able to conceive.
Okay. Now, infertility.
Yes.
What are some of the causes of infertility?
So infertility, let me broadly classify causes as those ones related to the lady and those ones related to the man, and we have a combination of both.
Okay.
So we have causes of infertility in males, females, and sometimes like up to 35% both are involved. So let's start with ladies.
Okay. Yeah.
So ladies have various, there are various causes. So one, we have causes to do with ovulation. So they are not able to conceive because they are not ovulating, or they are not ovulating regularly for that matter.
Yeah.
So here we have various medical conditions that can make a woman not ovulate.
Okay.
And many of them have to do with hormones. I'll give examples. For example, we have a woman who has a condition like polycystic ovarian syndrome. So these...
that is the PCOS?
PCOS.
Okay.
Yeah. Many of these women are not ovulating so all the time, so they end up with the fertility simply because of ovulation.
Yeah.
And the underlying problem is the hormones hormonal derangements that occur in polycystic ovarian syndrome are the ones that cause them not to ovulate.
Okay.
But we also have other conditions, like if the hormone that helps a woman to produce milk, we call prolactin, if it is high, a condition called hyperprolactinemia, they can also end up with infertility because they are not ovulating. Okay. Other hormones that can affect these are hormones of the that control the thyroid, the hormones from the thyroid gland. They can also affect these, and many other conditions. Okay. And lack of ovulation is one of the causes. Another cause can have something to do with the uterus. Maybe the uterine cavity has a problem. When you have a uterine cavity that has scarred, or it has something we call adhesions or synechia, the uterine cavity is not in good condition to be able to conceive. So you can have infertility because of that. Okay. But you also have other things. We can have growth into the uterine cavity. That is where the baby is usually carried. Yeah. So when you have things like a polyp or even fibroid that are growing into the endometrial cavity, that is where that can also affect the fertility because they can interfere with implantation. Yeah. We also have causes to do with fallopian tubes, the oviduct. That is the tube that transports the sperm and also transports the egg, and that's where they meet. They actually meet in the tube, and that's where fertilization occurs. So if you have a problem with the tube, either blockage or dysfunctional tube, then you are likely to have infertility. For example, if you get a medical condition that end up with a blocked tube, it means the sperm and the egg are not able to meet. Yeah. And now it can cause infertility. But we have conditions that will cause all the damage to the tube, so that even though the tube could be open, but the function of the tube is affected. Yeah. And so you also end up with infertility. Okay. So we have things that can affect the tube. We have things like endometriosis. We have things like infections, like pelvic inflammatory disease, PID. those things can actually affect the tube and consequently affect fertility.
Okay.
Another cause among ladies is, we call it, let's call it cervical factors, where now maybe there is a problem where now the sperms cannot be transported through the cervix into the uterus for fertilization to occur.
Okay.
And sometimes even cervical mucus can have antibodies against the sperm, and this can affect fertility.
Is that caused by hormones as well?
No, it's not caused by hormones, but it can be caused by immunological conditions, but it's not caused by hormones. Yeah, so that can also be a problem.
Okay.
Another thing that, but we have about 15% of infertility that we call unexplained infertility, where
you can't just explain.
We can't just explain. We have done all the tests, but we can't put a finger on what is causing the infertility. And that.
So what do you do there?
We do artificial reproductive technology techniques where we actually help these couples to conceive. So we have various interventions we can initiate in such a couple. We'll discuss them when we are talking about now the treatment options. So even those ones who have unexplained infertility, we have a solution for them.
Okay. Okay. So that's for the ladies.
That's for the ladies. And then for the man, you look at the things that are likely to affect either sperm production or sperm transport. So when you look at men, we'll have things to do with lifestyle. Lifestyle issues like smoking, heavy drinking of alcohol, all these things can affect fertility. Exposure to heavy metals, things to do with, some studies have suggested a lot of heat around the scrotum can actually cause it. And then we have other conditions that affect fertility in men, like when you have something called a varicocele, where the veins within the testes, they have swollen, and so that can also affect fertility. And then we have obstruction of the ducts that's supposed to transport semen that contains sperm. So when you have obstruction for some reason, either trauma or infections or maybe surgery, that can inadvertently cause obstruction of the ducts that transport the semen, that can also cause infertility among males.
Okay.
Yeah.
Perfect. Now, I see we have questions coming in already. So if you have a question you'd love to ask around infertility, please feel free. Our numbers are very open. On WhatsApp, it's 0721 105 105 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. So on all those social media pages, we'll be able to get your feedback. The last time we were here, we were talking about fibroids, yeah?
Yeah, sure.
Yeah. I see there's someone, you've mentioned fibroids, and there's someone who've asked for you to explain more about fibroids. I know we'll be getting there. Kidogo too, because we had the discussion, and of course, all the conversations that we've had on Afya Clinic, you can always get them on our social media pages. That is on Facebook and on YouTube. Ukienda pale, just search the topic, Afya Clinic. Utaweza kuipata pale. So fibroids, Afya Clinic. Utaweza kuipata pale. And you'll have all the answers that you need. But of course, at the end of the conversation today, we'll be giving you numbers so that if you need to ask any question, you'll be able to get the help. Yeah?
Yes.
Now, we talked about the causes of infertility for both the ladies and the males. But you've said there's a 35% chance that it could be both.
A multiple factors, yes.
Yeah, so please explain.
Yeah, so the fact that, for example, a woman has an issue with, maybe when you come for fertility workup, we usually do various tests.
Okay.
So we find maybe a lady has a problem, maybe they're not ovulating. So the fact that the lady has a problem with ovulation does not mean they don't have any other problem. So we usually do full workup, and when you do the full investigation of the couple, you find that even though the lady had a problem with ovulation, they have another problem, or the man also has a problem.
Okay.
So that becomes multiple factors. So that's what I meant.
Okay.
So you identified one problem, but as you evaluate the patient or the couple, you find that they have other causes of infertility, so that now you need to treat both for you to be able to help the couple to conceive.
Okay.
So that's what I meant.
Okay, okay.
Yeah.
Now, we always talk about risk factors of diseases. You know, ukikaa sana kwa baridi utapata homa and stuff like that.
Yes.
Do you have risk factors for infertility?
Yes. An important factor in fertility is actually age. Yeah.
Okay.
So age is important. Usually, when during, the follicles that where the eggs are supposed to come from, they start developing early when, in fact, before a girl is born.
Yeah.
Usually in the second trimester at about 20 weeks, that's when they have the highest number of about 6 to 7 million.
20 weeks.
Yes.
Okay.
At the time of birth,
they
have about 1 to 2 million.
Okay.
By the time someone is getting into puberty, they have about 300,000.
Okay.
Yes.
In a reduced too.
They keep on reducing. But generally, now, fertility starts declining from the age of about 30.
Okay.
Then it starts going down. Then it's significantly reduced.
30.
From the age of 40, it's significantly reduced. Such that if you compare fertility among women below 30 years, and those ones above around 40 years and above, you'll find that the fertility is now half at the age of 40 compared to someone who's in their 20s.
Okay.
So age is an important factor, such that the older a woman becomes, the less fertile they become.
Okay.
Especially after the age of 40,
Yeah.
the fertility really goes down.
Okay.
But starts reducing from the age of around 30
Okay,
onwards. So
I hear
that is a factor.
Okay.
Yes.
Another risk factor?
Another one is exposure to things that are likely to cause infertility. For example, if you have STIs, if you have sexually transmitted infections, what happens is that you are more likely to have upper genital tract infections like PID, and therefore you end up with infertility. And these risk factors for STIs includes, let's say, multiple partners, and all that. So these ones put you at risk of STIs, but STI put you at risk of infertility. And the more episodes of infections you have, the higher the chances of you having infertility.
Yeah. Okay. Yeah. I hear you. Now, is there any other risk factor?
Lifestyle, especially among men. Yeah. So certain lifestyles put you at risk of infertility. The kind of work you do, the kind of the exposure you have, the kind of diet you take has been associated in some instances with infertility.
Okay. Diet.
And
please explain about diet.
Okay. This one, there is no, studies have not confirmed a cause-effect relationship.
Okay.
But it has been shown that diets that are low in minerals, certain minerals like selenium and all that, they have something to do with infertility. Okay. And when you are exposed to extortive stress, if a man is exposed to that, they are likely to have to affect fertility. The thing is, some of these things affect the quality of the sperm rather than the quantity. Okay. You see, we can do semi-analysis. Yeah. We check the sperm of a man. It looks okay, but the quality of the sperms that are in there, it's compromised such a way that now it actually affects the ability to fertilize, but also the embryo that arises from that after fertilization, it can also be of low quality. Okay. And these are the things that have been associated with lifestyle and diet, the quality of the sperm.
Okay.
Yeah.
Now, is there anything like secondary infertility?
Yes.
What is that?
So we generally classify infertility into two categories, primary infertility and secondary infertility.
Okay.
Remember, we defined infertility as someone who is a couple that is unable to conceive and carry a pregnancy successfully after 1 year of attempting or unprotected coitus, regular unprotected coitus.
Okay.
Now, when it happens to a couple that has never been, a woman that has never been pregnant, and that becomes primary infertility.
Okay.
But if a woman has ever conceived and has ever been pregnant before, and now they have infertility, that's what we call secondary infertility.
Okay.
So primary, someone who has never been pregnant, but secondary is someone who has infertility now, but they have carried a pregnancy before.
Okay.
Yeah.
Okay. I hear you. Now, apart from the fact that you're probably not able to conceive after a year, is there any other diagnosis of infertility? Would you be able to know that you're infertile? Yeah. Yeah.
Okay. Since ultimately pregnancy is what we are talking about, so we can only talk of infertility if you have not been able to conceive. So it is not, of course, there's you can meet a patient because they have a certain medical condition, then you know that this lady is likely to have infertility challenges.
Okay.
Even though they have not attempted to conceive. But you know that this medical condition, for example, is associated with infertility. For example, if I found a woman who, for some reason, maybe they have, for some reason, they have genetic or chromosomal issues, they end up with no uterus. They have never developed a uterus. So if you don't have a womb, and that's where the baby is supposed to be carried, the fetus. So it means you are unlikely to actually be fertile. So such patients, we can even know that they will have infertility even if they have not attempted to conceive for a year. Because we know that the medical condition they have will put them at a situation where they cannot conceive.
Okay. Yeah. Okay. I hear you. Now let's get to take a look at some of the myths that surround infertility. As we said before, is that there's also stigma that we'll be talking about, which I think is something that we need to completely remove. You know, I think it's very, very important for us to be able to have such discussions in places where people feel safe to talk about it and they don't feel like they're being judged for it, because it's not a you problem, you know. And that's why we're having this discussion today. But before we get into the stigma part, let's just take a look at some of the myths that surround infertility. That is the Mythbusters. And for the first one is that infertility is always a woman's problem. Is that true?
Not true.
Yeah.
30% of infertility is men.
Yeah. Okay.
Yeah, 30% is men. So when we evaluate infertile couples, you find that 30% the cause is a man.
Yeah.
So it's not always the lady.
Yeah.
Yeah.
Okay. And the second one is that if you already have one child, you can't be infertile.
Not true. And that is where we talked about secondary infertility. Someone already has a child, but then they now have infertility. That's what we call secondary infertility.
Okay. To the third one is that stress is the main cause of infertility. Let's even just start by asking, is stress a cause of infertility?
Not really.
Yeah.
However, we have physiological stress that our body can go through that can affect ovulation.
Yeah.
For example, if you lose weight so much, your BMI is below 18, you can actually stop ovulating.
Okay.
If you exercise so vigorously, like some of the people who athletics and all that, you exercise so vigorously, it can also affect your ovulation. But those are now stress on the body, as it were, not really mental. So those ones have been shown to actually affect ovulation. Yeah.
Okay. So stress is not mainly a cause for infertility.
You know, you meet couples where they are in a, let me give you some instances that come to us in the clinical setting. So a woman comes to you and tells you, I'm very stressed. I am pregnant, but I'm very stressed. I don't want to keep this pregnancy. I've been having issues with my marriage and all that. So because of that, I don't want to keep this pregnancy. I'm very stressed about it. I've been stressed for the last 1 year. You see, they are stressed, but they're pregnant.
Yeah.
Yeah.
Yeah. So really, so, okay, I get.
So it doesn't affect much.
Yeah. Okay. And the fourth one is that lifestyle changes alone can cure infertility.
Oh no. Lifestyle changes alone cannot cure infertility. Remember the way we, for example, if your fallopian tubes are blocked, such a way that the egg cannot meet the sperm. Whatever you do with your lifestyle changes, it will not unblock the tube. You'll still be infertile. Yeah. So lifestyle changes alone cannot cure infertility.
Okay. But is it something that a doctor would suggest? If you have issues with infertility,
those things, exactly, those lifestyle changes that we said can affect fertility. If you do something about it, you can improve in those circumstances. So it really depends on the cause.
Okay.
Yeah.
Okay. I hear you. Okay. And the last one for the Mythbusters is that having regular periods means you're fertile.
Well, not exactly like that, but let me explain something about that. Having regular periods might imply that you generally have the hormones that regulate your menstrual cycles are okay, and these hormones also regulate infertility through regulation of ovulation.
Yeah.
So maybe the correct thing to say is that having regular periods might mean that you are likely to be ovulating regularly and therefore fertile.
Yeah.
But ovulation is not the only thing that is required for conception to occur. We talked about other things. We talked about the male factor, we talked about the tubes, we talked about the uterus. There are other things. So yes, you could be ovulating. By the fact that you're having regular periods, you are likely to be ovulating regularly. But it doesn't mean that now you are actually you are now fertile, because you can have other things. Your tubes could still be blocked and you are having regular periods. So again, you still are infertile.
Yeah.
Having said that, you can still be having regular periods. Okay, a woman who has regular periods is likely to be ovulating regularly. Let's just put it that way. Likely to be ovulating regularly. But you can have a woman who is ovulating regularly, and then they have other conditions that have caused some, the things we call adhesions within the pelvis, where you form some scars because of some reasons, maybe surgery, endometriosis, or PID. You form these things we call adhesions, and they are trapping your tubes, and they have, and the ovary. Basically, zimefunika ovary yako. So even if you are ovulating, the egg cannot be, and the tube is not mobile to be able to pick. So yes, you are ovulating, but we have other issues. So that now you are not able to actually conceive successfully. Okay. Yeah.
Okay. I hear you. And I see we have two more people who've sent some of the myths that they've had. And this is just to tell you, you can also send us. What is that thing that you've had? Hiyo unajua isi ukweli kabisa. But there are people who believe this is true. These are the myths that surround infertility. Share with us and we'll be happy to unpack that. Tujue kama ni ukweli ama it's a myth. Okay? We'll be talking about the treatment and the cure and all that.
Yes.
But even before we go there, just as I read these two responses.
Yes.
There's treatment, yeah?
Yes, yes.
There's treatment for infertility.
Sure.
So for people who've struggled with infertility, they can always get help.
They can always get help.
Okay, that's very important. So, anasema, one of the things that you've heard is that you don't need to worry about infertility until you're older. Tell Ambiwa, you don't need to worry about infertility until you're way older. Is that true?
No. You see, the thing is, as we said, the fertility generally reduces with age in general. So if you are waiting until you are 40, now even when we intervene, you are more likely to succeed if you are younger than if you are older. I'll give you an example. If, for example, we are doing treatment through IVF, which we'll talk about. If you use eggs from a 25-year-old lady and you get eggs from a 45-year-old, those are two different people.
Yeah.
The eggs from a 20-something-year-old is likely to succeed and give you a successful pregnancy than eggs from a 45-year-old.
Okay.
So don't wait. If you have an infertility issue, come early, seek for intervention early. Chances of these interventions succeeding are higher when you are younger than when you are older.
Okay.
So don't wait. Don't wait until you are 40. That something is when you, if you discover you have an infertility issue, even in your 20s, come for intervention.
Okay. Does age apply the same for men as well?
Yeah, but less effect.
Okay.
Yeah, less effect on men. Yes.
Okay.
Because men are also, as they grow older, we have other things that come in. The quality of the sperm can also reduce, and they can also have, the things we call fragmentation of the DNA. It's likely to occur at an older woman than in an older man than a younger man.
Okay.
And all that. But the effect of age on the men is less compared to the lady.
Okay.
But yes, it does affect.
Okay. I hear you. And the second person who sent, anasema aliambiwa infertility means you can never have children. Is that true?
No, it's not true. Infertility couples actually do have children eventually. It's just a matter of they have it with intervention.
Yeah.
Yeah. So when we tell you you have infertility, it doesn't mean you'll never have children.
Yep.
It means you need assistance to get your babies.
Yeah.
But you will get your babies.
Yeah.
Yeah.
Perfect. Now, what are some of the myths that you've had in your line of duty, especially from patients and couples?
Lots of them. Most of the myths have to do with culture. Yeah. Yeah. So maybe if the couple is not able to conceive, people think maybe they have been bewitched.
Yep.
You know, those things are there. They think that most of the time they think man cannot have an infertility issue. Yeah. So they think it can only be ladies. Most of them think that maybe it's your background. Maybe you come from a family that has infertility issues.
Yeah.
So there are lots of myths around it, but a lot of them have to do with ignorance and basically culture.
Okay.
Yeah.
Okay. And I think that's something that we really have to deal with.
Yes.
And that is where we talk about stigma.
Yes.
Would you say there's a lot of stigma that is associated to infertility?
Yeah, there is. When someone, especially if you are in a community and people realize that you are not able to conceive and carry a pregnancy, and they start looking at you like you are less of a woman or a man because of that, and so that stigma is really there. So most of the time, couples tend to keep this a private matter because of that stigma. Yeah. Because once people discover that you are not able to have babies, and they start stigmatizing you, they start talking to you as if you now have a problem, you are less of a man, less of a woman, you are not jatosha.
So what can be done?
Just education. Infertility is just like any other medical condition, and that has a solution. So it's just a matter of educating people that just like any other medical condition, it happened to be that of infertility. And so people should seek solutions, and there are solutions to it, so that they are not stressed about it, yet we have solutions out here. Yeah.
And I love that you've mentioned that we have solutions. I think that's what's really, really important.
Exactly.
For people to know that there are solutions. It's not a death sentence.
No, it's not.
No, it's
actually,
not. Actually,
infertility doesn't kill anybody.
Right?
No, you won't die from infertility.
Yes, it doesn't. Yeah. So it's very important for us to know that.
Yeah.
So if you have any questions that you'd love to ask, I see that you're having questions that are coming in already. We'll start tackling them immediately after the break. Okay, so I see we have just a few minutes for us to take the break. So immediately after the break, we'll tackle all the questions that you've sent already. So just to remind you is that our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. So on the comment section, we'll be able to get your feedback. And of course, on all social media pages at Rachel Kahugu, nitaweza kupata ujumbe wako loud and clear. Okay? Now, we're getting into the part where we talk about treatment. So just to mention, and then we'll explain to Kirudi, what are some of the treatment options for infertility?
Okay, treatment options depends on, of course, on the cause.
Yeah.
Yeah, so, but I can just mention some of them. We have medication. There's a medication we can give you as part of infertility treatment.
Yeah.
We have surgery. We can do some surgeries. We have artificial reproductive technology procedures. For example, intrauterine insemination, in vitro fertilization, IVF. We have others that are, advanced procedures in IVF, like ICSI. We'll be able to explain when we come back. And then for male, we also have medication for males, but we also have procedures to be able to recover the sperms and use them for artificial reproductive technology.
Okay.
Yeah.
Okay. I see there's someone who's asking, how would you know that you're not ovulating?
How will you know? Now, there are signs of ovulation. There are signs of ovulation where around the time of ovulation, you have a bit of, people rarely detect the changes in their body temperature, but cervical mucus, most people are able to detect that. So the changes in the cervical mucus, so it becomes more light, and then it is thin and stretchy. When around your mid-cycle, like around 2 weeks after your last, or after your period, then you know that around that time you are ovulating. However, if you have very irregular periods, chances are you are not ovulating, or you are hardly ovulating. Maybe when you have like menstrual periods every 2 months, another one after 6 months, you have another one, another 8 months is when you get another one. Chances are you are not ovulating. Okay. But we can't really conclude in most cases based on all those things. There are objective ways of testing and checking whether we are ovulating or not. Okay. We can either test to predict ovulation, or we can test retrospectively to confirm that you are ovulating. Okay. You are ovulating. Okay. So if you have really doubts about ovulation, we have objective ways of determining whether a woman is ovulating or not. So when you go to the doctor, they'll be able to take your history and examine you, and they'll be able to determine whether you need some of these tests to confirm whether you're ovulating. Okay. Yeah. Okay. So you can go get checked. You can go get checked. We can always confirm. Yeah. So just to clarify on this, and not to digress, the last time we had a discussion should be on fibroids. Yes. Yeah. You said it's very important for ladies to just go get checked on their health in general. So just go to a gyna, get checked, make sure that you're okay, not that you have any problem. Yes. Is that a thing? Ama si lazima ungoje tu the days when you're married and planning to get kids. Now you go get checked. Okay. Yeah, we talked about a well woman clinic, where you get checked generally to just check if you are healthy and if there are any issues cropping up, so that you can intervene early. But for matters reproductive, we talked about things like pap smear for cervical cancer screening, breast examination, and all that as part of the well woman clinic. Yeah. However, when you come, we don't typically, we don't typically test you, for example, to check whether you're ovulating as routine. However, when you take your reproductive health history, and then we realize you are having irregular periods, you are having So we can recommend further evaluation to determine if you have any underlying cause for these irregular periods, for example. And that can also, and the cause can also be related to fertility or lack of it. So through that, we are able to uncover things that are likely to give you fertility challenges in the future. But when you come, we generally don't test people for fertility issues when they come to a well woman clinic. But through their history, if we find there's something alarming, that's when we can take that route. Yeah. And just, I remember the lady asked about the fibroids and infertility. It's good I clarify this, that majority of women who actually have fibroids just conceive without any issue. Majority. Fibroid affecting fertility is rare. And the ones I mentioned, the few that are in the cavity, occupying almost the whole cavity and preventing implantation, those are the ones that are rare. Majority of women with fibroids actually will be able to conceive and will carry a pregnancy. This affects very few women. Yeah.
I hear you. Perfect. So I see time is not together with us. So we'll be taking, is that usually good English? We'll take a very short break and then we'll be coming right back. Please remember, this is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is Afya Clinic, where we talk about everything health in a very simplified manner that you'll be able to understand what is affecting you or what is affecting the people around you, so that you'll be able to, one, take care of them, and also just take care of yourself. You know, we said sensitization is very, very, very important. So taking a very short break. Tukirudi will be coming back to answer all your questions. Tunaziona, we are receiving them. We'll be coming to answer all your questions, but also to wind up on our discussion. Today we're talking about infertility. So a very short break and then we'll be coming right back.
MBCI Television, transforming lives.
This August, something extraordinary is happening. A season of prayer, power, and purpose is here. Join us for the August Word and Prayer Festival at Heaven's Gate Prayer Mountain, Harvest Cathedral, and Church Without Walls. This year, we are reclaiming the mountain and reviving a generation as we pray for the mountain of education. From the 4th to the 10th of August, come and experience divine encounters like never before. Every morning at 5 a.m., every lunch hour at 12:30 p.m. and don't miss the 12-hour worship experience on Friday, August 8th from 6 p.m. to 6 a.m. Hosted by Apostle John Kimani William, this interdenominational gathering is for all. Come, let's dig back the mountain together, as Caleb declared. Now, therefore, give me this mountain. Joshua chapter 14 verse 12. Don't miss it. Mark your calendar. August 4th to 10th, 2025. For more details, scan the QR code or join us live on MBCI TV and radio. See you there.
Dominion Chapel Ministries International, Goshenland, Kiserian, Kenya, hosted by Bishop Peter and Reverend Sophie Mankura, presents Turning Point International Conference on the 4th to 10th of August 2025, themed Wind of the Spirit from Acts chapter 2, verses 2 and 3. Guest ministers will be Archbishop Harrison Manga from Kenya, Apostle Richard Mayanja from Uganda, Bishop Daniel Osoi from Kenya, Reverend Wale Joseph from Nigeria, and Apostle D. Naila. Guest artist Kestin Mbogo, Resian Le Perez, Pastor Joseph Kaya. Sessions will begin from 8 a.m. to 5 p.m. Revivals from 7 p.m. to 9 p.m. And live streams on Facebook at Dominion Chapel Ministries International Kenya and YouTube on Dominion Airwaves DCMI. Tupatane Goshenland Kiserian. Welcome all.
Welcome to Goshen Medical and Technical College Thika, where dreams become reality and futures are empowered. At Goshen, we offer a wide range of courses in both the medical and technical fields designed to meet your aspirations. Medical courses such as Kenya Registered Community Nurse, Theatre Technology, Health Records, Orthopedic and Trauma Medicine, Nurse Assistant, Medical Engineering, Laboratory Science Technology. Technical courses like Catering and Hotel Management, Fashion Design, Hairdressing and Beauty Therapy, ICT and Computer Packages, catering to your creative and technological ambitions. Our students receive hands-on experience through industrial attachment, which we organize for them, ensuring that they gain the valuable practical skills. Conveniently located in Thika Makongeni, right off Garissa Highway, behind Leather Industries. Goshen Medical and Technical Training College is easily accessible. With affordable fees, you can pursue your dreams and achieve your goals with Goshen. So what are you waiting for? Call us today at 0750-264-044. Goshen Medical and Training College Thika.
Empowering future professionals.
Get ready, Nakuru. Something divine is coming your way. Nakuru Happy Church proudly presents Maturity Convention 2025. The theme is Open Heavens from Genesis 28 verse 12. Mark your calendars from Wednesday 6th of August to Sunday 10th of August 2025. Join us daily from 5 p.m. to 7 p.m. for a life-transforming experience, hosted by the anointed Bishop Dr. Joseph W. Kamau and Reverend Jane Kamau, and ministering will be Reverend Patrick Mwangi, with a powerful guest speaker, Bishop Ezekiel Mukayagi from Nakuru. We will have a spirit-filled worship led by none other than the Revivals. This is your season for breakthrough. This is your moment to walk under open heavens. Join us at Nakuru Happy Church, where joy, purpose, and maturity meet. Don't miss it. Bring your family, invite a friend, and come expectant.
She's clothed with strength and dignity, and she builds her house with wisdom. Proverbs chapter 14 verses 1 reminds us the wise woman builds her home. And now the time has come for women to rise, build, and transform nations. Welcome to Abigail's International Ministry 2025 Conference, a life-changing gathering of women, worship, and the word, hosted by the visionary servant of God, Pastor Julia Karanja.
Na neno ambalo Mungu alimpea kuhusu hii huduma ni ya kwamba hiki ni kijito cha furaha.
From across the nations, God has appointed his generals, vessels of power and wisdom, to pour into us in this season of purpose. We are honored and blessed to have Reverend Esolom Karanja, Pastor Nancy Chimwega, Reverend Miriam Gethenji, Reverend Rose Chimega, Reverend Jane Kamau, Pastor Dr. Francis Njenga, Reverend Sami Mahoya. These great ministers carry divine insight and revelation, equipped to impart wisdom that will build homes, communities, and generations. Our hearts will be lifted in powerful worship led by anointed vessels of praise, Pastor Andwo, Pastor Mary Theuri, and Pastor Maggie Dawn. Dates from 12th to 17th of August 2025, time 9 a.m. to 6 p.m. daily. And to crown it all, join us for the Sunday rally, the grand finale on 17th August from 2 p.m. to 6 p.m. Venue Karatina Stadium under the big tent, live on Abigail's International Ministry Facebook and YouTube. This is more than a conference. This is a call to destiny. Be empowered. Be the wise woman. Abigail's International Ministry 2025 Conference. Woman is a builder.
MBCI Television, transforming lives.
Right, we are back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is Afya Clinic, where we talk about everything health. Today we're talking about infertility, and we're here with Dr. Wekesa. He's the best gynecologist in Nakuru, in Kenya, in south of Limpopo, north of Sahara. You know, you say those things and usually not just the two of them. Please text in and tell us. Thank you so much for being here, Doc.
Thank you.
Today we're having this discussion just to unpack what infertility is and to be able to get an answer to the many questions that you're having today. Now, we have a lady who's asking, can miscarrying a baby at an early age cause infertility?
No, miscarriage does not cause infertility.
Yeah. Maybe let's just start with what is miscarriage?
Miscarriage is a pregnancy that does not end successfully, where the fetus comes out prematurely, usually either in the first or second trimester. Yeah.
What causes miscarriage?
Oh, there are many causes. That is really a discussion for another day. But there are many causes that can. There are many causes, but the majority of the pregnancies that end up that way are affected by chromosomal abnormalities, like half of them.
Okay.
Such that the chromosomes of that fetus most of the time are not compatible with life, and so the pregnant ends up as a miscarriage. So like 50% of them. The other 50 has multiple causes to do with the mother, to do with the baby again, but mostly the mother, the other 50. Okay. Yeah.
Okay. We'll be having a discussion around that. As you said, it's a whole discussion by itself. I think we've talked about that though. Get to look at that. Okay. Let's get to take a look at this. Anasema shalom and good morning. Good morning to you as well. Anasema we have been in marriage for 1 year, but you have not conceived yet. We are together all through. Also, she has changed dates of periods. What would be the problem?
They have been together for 1 year. We are assuming that they have been having regular unprotected coitus for that 1 year.
Yeah.
And so if they have not conceived, then they are likely to have an infertility issue, and so they should come and seek help.
Yeah.
It's also good for them to remember that the longer you take before you actually conceive, the higher the chances that you actually have a fertility problem. Yeah.
Okay. The longer you take before you conceive?
The longer you take, the higher the chances that you really have. Remember we said that many women who don't conceive after, let's say, a month of unprotected coitus, they will still conceive, given time.
Yeah.
Now, if you take longer and longer, now 1 year, 2 years down the line, you are not conceiving, the higher the chances that now you have a real problem that is making you not conceive. You have infertility.
Okay.
Yeah.
Okay. And so I have my friend who has a severe pain during the time she received her periods. That's on the lower abdomen. Does this cause infertility? She feels like the fallopian tubes ziko zimejaa na kujifunga. She's 21 years old. How would you know that though?
Yeah, she wouldn't know.
I think we really overthink sometimes.
Yeah, she wouldn't know. But painful periods in such a young woman, it could be, there are causes of painful periods, really. This what we call dysmenorrhea. They could just be having primary dysmenorrhea, and another common cause is endometriosis is a common cause.
Yeah.
And by the way, endometriosis is associated with infertility. So whereas painful periods are not a cause of infertility or not an evidence of infertility, but the underlying cause may have something to do with infertility, for example, endometriosis. So she needs to get checked to find out why she's having painful periods.
Yeah.
Yes, and therefore she needs to be sorted.
Okay.
Yeah.
Okay. Anasema sema nani, which is okay. But anasema her period stops or stopped rather, no conception, and I'm worried. Is there hope to conceive?
I'll really be interested to know her age.
Yeah.
Yeah, if let's say she's in her 40s and periods have stopped, and so she's asking whether she has hopes for conception. Now, when your periods have stopped, like for a year or so,
Yeah.
And then for, let's say you are in your 30s, that could be a sign that you might be having premature ovarian failure. And so you need to be checked to confirm if that is the case.
Okay.
Or she could just be having secondary amenorrhea where she was having periods, then they have stopped for some months. So she could be having that. Whichever case, she needs to come checked so that you can find out what is the underlying thing that is causing the periods to stop.
Yeah.
And that will now tell us whether this has something to do with fertility or not.
Okay.
Because, for example, if she has premature ovarian failure, then definitely that affects fertility.
Okay.
Yeah.
Okay.
So she needs to get checked so that we know whether what is happening, why she's not having her periods, and therefore determine whether she can conceive or not.
Okay.
Yeah.
And Doc, what are the causes of pain in a woman's womb after giving birth to a baby?
Soon after giving birth to a baby, usually the uterus tries to contract and come back to the original size, pre-pregnancy size. So those contractions that occur soon after birth is what causes the woman to get the cramping pain.
Yeah.
Yeah. So it is the uterine contractions that occur, but they are important because they help the woman to stop bleeding. So, but they also cause pain.
Okay.
But that is not a big problem. She can always get painkillers to sort that out.
Okay.
Yeah.
Okay. But it shouldn't be severe pain, should it?
It shouldn't be severe pain.
Okay.
Yeah.
So if it's severe, you need to go get checked?
Yeah, it could be. And if it's not immediately after birth, she didn't say how long. If she's having, let's say, months, weeks and months of pain after birth, now that one has a different problem. They need to get checked. Yeah.
Okay.
Yeah.
Perfect. Let's get to take a look at this as well. We'll be checking from Facebook and YouTube as well, so you can always continue sending in your messages. We'll be able to get it. Anasema, good morning, Doc. Good morning to you too.
Morning.
Anasema, okay, Anoliza, why is it that I'm having cramping all through, even after my pees? Is it normal to have cramping?
No, it's not normal. Having cramping throughout, even in the absence of menstrual flow, is not normal.
Yeah.
Just she needs to come. The advice is that she needs to come and get checked.
Yeah. What could be the cause?
Causes of cramps are many.
Yeah.
Ranging, they could be cramping pain, maybe they have a big cyst. They could be having this cramping pain, maybe they just have fibroids. They could be, so there are many, but once she comes over, or they could be having this pain that might not have anything to do with her reproductive organ. It could be something else in there. So once she comes, you'll be able to see what's up.
Okay. All right. So I see we have more questions coming in, but even with that, we'll be having numbers at the end of the conversation so that you'll be able to go get checked and to get more information, because that's very important.
Yeah.
But because of time, let's talk about the treatment.
Yes.
Yeah, you told us kidogo about it. So
Yes.
please explain.
Okay. So do we start with male or female?
Female.
Female.
Yes.
Okay. Yeah. So treatment, as I said, depends on the underlying cause. So I'll highlight some of the causes and what we do.
Yeah.
So for example, someone who has a problem with ovulation, so we treat the underlying cause of anovulation. So for example, if you are not ovulating and prolactin, the hormone I told you, prolactin hormone is high, hyperprolactinemia, we give you medication to bring the hormone down, and by doing that, you are able to conceive.
Okay.
If you have any other, let's say you have thyroid disease that is making you not ovulate, then we give you medication to sort out that, and you are able to ovulate.
Yeah.
You have, for example, polycystic ovarian syndrome, where we have medication we can give you that's supposed to now improve your fertility. But beyond that, another medication we give is a medication that we say that we give that we call ovulation induction medication.
Yeah.
So this medicine we give you to boost your ovary to be able now to produce the egg. So these are timed medication.
Yeah.
When you come, we are able to prescribe for you, and they are able to now help you to ovulate if your problem is ovulation.
Yeah.
And then another problem that a woman can have is, let's say, blocked fallopian tubes and the adhesions. This can be managed surgically. Although the problem with blocked tubes depends on where, depends on many other factors. Majority of the women with blocked tubes will not be helped by surgery, will be sent for IVF instead, will benefit more from IVF.
Okay.
Which I will explain.
Okay.
But a few of them might benefit from surgery to have the tubes unblocked and are able to conceive.
Okay.
If you have, for example, adhesions, the scars I talked about within the pelvic cavity that is holding on to the tubes and the ovaries and all that, and you're not able to successfully conceive, we can actually do laparoscopy and able to release all these things and somehow increase your chances of conception.
Okay.
If you have uterine factors like the submucosal fibroids, the fibroids I talked about that are into the cavity and the polyps and all that, or you have scars within the adhesions within the uterine cavity, we are able to do what we call hysteroscopy, a procedure where we introduce an instrument within the uterine cavity and they are able to actually sort out those problems. And that can also improve your chances of conceiving. If you have cervical factors, for example, we can bypass that by doing an IUI, intrauterine insemination. We can now prepare the semen from the man and introduce it directly into the uterine cavity and bypass the cervix, and you are able to conceive.
Okay.
Now, that is for some such causes that I talked about. But for women, for example, who have an ovulation, who don't respond to the regular medication that I've talked about, ovulation induction and all that, now we go a notch higher. These are the women who can now go ahead and do an intrauterine insemination. We usually do it like 3 times. If it doesn't succeed, then we go again a notch higher. So we now can recommend that they can go for IVF. And IVF is what now I mentioned earlier, is in vitro fertilization. Here, we fertilize the egg outside the uterus, and then once we get the embryo, we now get it into the uterine cavity. And we don't always get it. We can put it also in the tube, but that's a different procedure.
Okay.
But let me talk about IVF before I talk about the others. So IVF is where now we take the egg. Okay, first of all, we stimulate the woman to be able to produce the egg. We use medications. You can use oral medication or some injections. And then we stimulate the woman to be able to produce the egg. Then there is also some medication we shall give her once the eggs are now mature to now ovulate.
Okay.
For a natural, for an IVF cycle, now they will not be able to ovulate. Now when it is mature enough, we are able to harvest it. We are able now to aspirate the eggs and use them for fertilization outside the uterus.
Okay.
So that is, we do ovum pickup. We are now able to pick the egg. Now once we pick the egg, we get the sperm, and then the sperm is able to fertilize the egg outside the uterus in the IVF laboratory. And then now we take the embryo after fertilization. Once the sperm fertilizes the egg, whatever comes out of it is an embryo. Now we take the embryo and introduce it into the uterine cavity, what we call an embryo transfer.
Okay.
And now once we do that, then we give some medication to support the pregnancy, and now the pregnancy is able to take off.
Okay.
Then we later do a pregnancy test to confirm you're pregnant, and then we manage the pregnancy as such.
Okay.
So that is what I was calling IVF.
Okay.
Yeah, in vitro fertilization.
I hear you.
Yeah.
Okay. So that's for the ladies.
That's for the ladies you can do. And then you can have, and remember, the man is okay, the sperm is there, the problem was the lady. But we can also have a situation where the man also has an issue, maybe they don't have enough sperms and all that. So we can still do IVF, but if the quality of the sperm and all that is also an issue, we can always select the best of the sperms and directly inject into, use it to fertilize the egg in the lab. And that's what we call ICSI, intracytoplasmic sperm injection. So we select the sperm and introduce it and specifically have that sperm fertilize the egg. It's also part of the IVF, but now we are, instead of leaving the sperms to just penetrate and one of them to go in and fertilize, now we specifically help to fertilize by introducing a sperm. So that is again part of the IVF. So it really depends on the cause and if the man is okay or the man is not okay. So we do that. So we can do IVF for people who have blocked tubes. We can do IVF for these people who with an ovulatory, which is like polycystic ovarian syndrome that I mentioned earlier. So all those people can benefit from IVF, especially if the other measures of treatment have failed.
Okay, I hear you. Now, with that, I think that was very important, just to make sure that people know that there's always treatment.
Yes, there's
always treatment. Okay. We have an 18-year-old here.
Yes.
And she's asking, Doc, my periods come, but the flow is very low and no cramps. Is that a problem?
She's 18 years?
Yeah.
She has regular periods?
Yeah.
But no pain?
Okay. About the regular periods, I just have but the flow is really low.
Low?
Yeah. And no cramps at all.
Okay. I don't know what she means by, we don't know, maybe low, how low, but if she's...
I think she means just a light flow.
Yeah, it's normally if the flow comes for like 3 to 5 days, that's normal. Actually, even up to 7 days is normal. So if you're having the flow of at least 3 days, then we shall consider that one to be normal. And if she's not having any cramps during periods, again, it's normal. It's not every woman who gets cramps during periods. Some don't get, and that's still okay. So, but how low it is, if she could explain, then we'll know whether that is really normal or not.
Okay.
Yeah.
I see. Anasema, okay. Anasema, I'm 44 years old. I've had a mastectomy surgery when I was 41. Now I'm trying to conceive, but it's not possible. My period have also become irregular. Kuna treatment? Can I get help to conceive?
Yes, she can get help. So she had myomectomy at the age of 41. Now she's 44.
Yeah.
Now she needs a full infertility workup to determine when she's not conceiving. Especially when the periods have become irregular, it might mean that her fertility levels have gone down. So she needs a fertility workup, and after that she needs treatment. These are a lady who might benefit from even IVF, but she needs to have it done early because she's already late. Chances of success are low now because she's at the age of 45. And we might not even use her eggs at the age of 45. You might use an egg donor for her to be able to succeed. So she needs to go for this evaluation sooner than later because she's already late. Yeah.
But good thing is that there's hope. So
hope.
we'll give the numbers at the end. And so my period stopped 2 years ago. I bleed after intercourse. Is that normal? 2 years ago.
If she's bleeding, how she hasn't said her age. But bleeding after intercourse is abnormal. That's abnormal. She needs to come for evaluation to determine the cause.
Okay.
It could be something not so bad, like even a polyp or infections, to something as serious as cervical cancer. So we don't know unless she comes for review, we will be able to know. But the thing is, it's abnormal, she needs to get checked.
Okay, perfect. Now I see we have many questions coming in. We might not be able to read all that, but we'll be having contacts, as you said, at the end of the show. So any other question, we have answered every question in Imebaki we've tackled on it. But if you have a specific question you'd love to ask, please feel free to reach out to Doc as soon as we give the numbers, like tukimaliza show. Okay? As soon as you give the numbers, and you'll be able to get help. Now, do you have at least one success story that you'd share with us on this topic of infertility? A couple that you've worked with, or a lady?
There are so many.
Okay, then just give us one.
There are so many success stories. I'll give one of a lady and one for the man. Yeah.
Okay.
So for the lady, we have the most recent one. Is a lady who had infertility. So this lady presented with history of inability to conceive for like 2 years. After workup, we found that one of her tubes was blocked. So there was a small chance that she could conceive with another one.
Yeah.
So after everything, she said we better try and see whether she can conceive before we do any other intervention. Whether she can conceive naturally with one tube. Well, she did, but then it turned out to be ectopic.
Okay.
So she turned out to have an ectopic pregnancy.
Yeah.
And before she knew it, it was ruptured. So we went to theater and, sorted out the ectopic pregnancy. And of course, because it had ruptured, part of the tube was removed.
Yeah.
Now, so the other tube was blocked, his one has been removed. So basically the problem got worse.
Yeah.
So the option we had is for her now to go for IVF. So she went for IVF and she got a baby girl. She successfully got a baby girl.
Okay.
And so that was in 2019.
Okay.
But then we have something called cryopreservation. So what happened is that more embryos were fertilized.
Yeah.
And some of them were preserved. 2 of them were preserved. So down the line, that was last year, she wanted to conceive again. So she went back to the IVF center. And 2 embryos were transferred.
Yeah.
And she got twins, now boys.
Okay. That's good.
Unfortunately, one of them passed on, but she has 1 son.
Okay.
And now the first one was a girl. So she now has 2 babies.
Yeah, that's good.
Yeah, that's a success story of IVF.
Yeah.
That's a recent one.
That's amazing.
There is another one now for the male infertility. There is a patient who came in. Actually, this one was combined factors. The lady had polycystic ovarian syndrome as a cause of infertility, and the man, after workup, she had low sperm count, what we call oligospermia.
Yeah.
Usually the normal sperm count is supposed to be at least, total sperm count is supposed to be at least at 9 million. And the concentration should be at least 15 million per ml. Okay, his was less than 1 million. It was actually about 500. Concentration was about 500 per ml, so it was low. When we did workup and scrotal ultrasound and everything, we didn't find any other problem.
Okay.
So we decided to put her on medication to improve the sperm count. And she was treated, and after 4 months, we repeated semen-analysis again. The sperm count was normal. Actually, the total sperm count was 42 million, and that was good enough.
Yeah.
So The lady was also on treatment for polycystic ovarian syndrome. We did ovulation induction for her, and now the sperm count for the man was normal. So they actually conceived. Again, it was a baby girl. Now this one conceived through a natural cycle, just through ovulation induction for the lady after sorting out the oligospermia for the man. Yeah, so that's another success story, which we didn't even have to do ART. We just used medication and they were able to conceive.
Okay.
Yeah.
Perfect. Wow. So, I mean, that was very important for us to know that there are success stories, and that's just two of very many. Yeah.
Yes,
So if you're there, you'd like treatment, or you know that you need treatment, this is just for you to know that we have doctors in place that are there to help you. And every time we say that there's a God who heals, absolutely a God who heals, but also He's allowed us to have doctors in place that would help us. Yeah. So that's why we're having our doc today here in studio. So what would be your parting shot on today's discussion, the whole discussion about infertility? I know that you're going to be getting tips in a very short while by Brenda, just to get to know, kama haukuko hapa tukianza, just to help you understand what are some of the things that you've learned since you started the discussion from 8, of course from 7:30, the music, and then you got into the discussion from 8. So we'll be getting to look at that. But for now, Doc, what are some, what would be your parting shot?
So my parting shot is that through technology, now even women who previously were considered infertile and could not have a chance of getting babies, now they can get babies. So people should not be discouraged when they have been diagnosed with infertility. Instead, they should be consistent to seek help, and they'll be able to actually conceive. Technology has really helped in this, so that now even when you have majority of infertility can actually be sorted through technology. Most women diagnosed with infertility are able to conceive and carry a successful pregnancy. It's just a matter of, sometimes it's a matter of cost and all that, but the solution actually does exist. In this country, we do IVF, we do almost all the artificial reproductive technology. We do it here in the country, so they don't need to seek for help elsewhere, outside the country and all that. We have IVF centers, many of them in this country now. So women are able to actually achieve their dreams. So whenever someone is diagnosed with infertility, let them come and be assisted. Now, for the women who are worried about fertility, maybe you have a job, you want to go for masters, you want to do what? You have a lot of things to do before you now embark on your reproductive career. So you are saying, okay, I have 1, 2, 3, maybe I want to get married at 35 and then get children at 38, and I'm worried when I'm 38, will I get babies? Now we have a solution. You can even freeze your eggs. We can harvest your eggs and freeze in case you're worried. When time comes, we simply use them. And you get your own babies. So technology has really helped. People now have a lot of options. So the thing is, whatever your dream is, in terms of getting babies at whatever stage in life, as long as it's within your reproductive years, you can always get help. So seek help and you'll be sorted.
You'll get it. All right, perfect. Please share your numbers for the people who would love to, reach out to you for help or for, for intervention. And also the location for Preston Medical Center.
So Preston Medical Center is located at Jennifer Area Hub on Tomboya Street of Nakuru Town. We are on 5th floor. So once you're on 5th floor, you see Preston Medical Center, and once you're there, you'll be sorted. We are open Monday to Saturday. We close on Sunday. You can call for a booking, although we also sometimes allow walk-ins, but it's good to call for a booking. But even if you walk in, it's okay, we can attend to you. So our number is 0791 99 1022. Yeah, you can call that number for a booking.
Okay, perfect. I know the numbers are there on your screens. Thank you so much for that that session. Please, you can share the number again.
The number is 0791 99 1022.
Perfect.
Yeah.
Thank you. So that is it. Thank you so much, Doc, for that session. I think
You're
that has
welcome.
been very enlightening, and I know that you've been able to learn something from today's discussion. If you're there, you'd like to get more treatment, or treatment rather, please make sure you visit Preston Medical Center.
Yes.
You said Ikori Rehab in Nakuru.
Yes, Rehab in Nakuru town.
In
Yes.
Nakuru town.
Yeah.
So make sure you visit, and if possible, please call and book. That's very important.
Yeah.
But they can always call.
Yes, they can always call us
Okay.
within the working hours.
Yeah, you can always call within the working hours. That's very important. Perfect. So thank you so much for that session. Thank you so much for being here. If you did come in a bit late, we'll be having Brenda who will be taking us through the show in a few minutes. So just to tell us, Tulianza Wapi, what are some of the pointers or take-homes that you should not forget from today's discussion?
Actually,
okay?
I'm very ready.
You're ready?
Yeah, I'm very
Perfect.
ready.
So Brenda is there with us. Brenda, how are you?
I'm good.
Have you been?
I've been awesome.
Perfect.
I'm pretty pumped up to share the pointers.
Okay.
And I love your new hairstyle.
Thank you. Thank you. All right. So take us through, what are some of the pointers that you've gotten from today's discussion?
Yeah, for today's pointers, there were a lot of scientific terms here and there. Yeah, really scientific. I couldn't get all of them,
Yeah.
but I got some.
Okay.
So that's a great thing,
Yeah.
I hope.
Yeah.
And for our first point is that infertility is when a couple fails to conceive after trying for 1 year with regular unprotected coitus. And you have to underline that regular. Our doc said, not once in a month or a few times in a month, or yeah, like that. And he said that infertility, it can depend. It's not really that the female is infertile or the male is infertile. Is that it's a 35% chance for both of them, and that is a sort of a notion that people usually had, that most of the time we assume it's the females who are infertile. Now that we have heard from the doc that it's a 35% chance, at least now we are aware. And our second point is that causes of infertility in women can include irregular ovulation. That's when you ovulate rarely, or some people don't at all. And growths in the uterine cavity, that is like fibroids. But he has said that in fibroids, for most women, actually a lot of percentage of the women usually give birth, they conceive actually. So that is a point, but it's a 50-50 chance. And fallopian tube issues, that is like blockages and that kind of thing. And then we have cervical factors. The next point is that causes of infertility in men include heat around the scrotum and infections affecting sperm productivity or delivery. He has said that there is a sperm count, and then there is sperm quality that can affect the fertility in men. And the next point is that risk factors for infertility are age, that is for both females and males. For males, that is the count of your sperm count can reduce, and for females, when a female, akifika that age of menopause era, that is, anaweza kosa ku give birth. Actually, I've seen a few times in the news, but that is why we see it on the news, that a female over 65 giving birth, that is a miracle. And sexually transmitted, okay, where am I? Okay, that is infertility, our age, sexually transmitted infections, that is STIs, and unhealthy lifestyle habits that include work or poor diet. He has mentioned that a lot. That is why he has said that we need to go for checkups, mostly, okay, I've heard for ladies, but also males, right? Yeah, all of us, we are supposed to go for checkup. as early as even now, even before we get into that institution of marriage. And our next point is that primary infertility is when a couple have never conceived. He has mentioned primary infertility and secondary infertility, and he said that it doesn't mean that because you have like 2 children, that doesn't mean that you can be infertile. So he mentioned primary infertility. That is when this couple has never conceived before. And then secondary infertility is when a couple that has previously conceived now is unable to do so. And he has also said that on the other side, that it's possible to have infertility, but there are also treatments for infertility. For example, IVF. I used to watch this lady online. She's actually Nigerian, who was telling people who are infertile they can go for IVF. And she used to do a lot of syringes on her stomach. I don't know what that was for. But yeah, now that technology has come in and it's making life better and better for us, why can't we go for it when it comes to that side that we made it? So that was all I had. Okay. My name is Brenda. It was a pleasure.
Thank you. Thank you so much, Brenda, for that. Doc, is that right?
Yeah,
you followed through.
Yes, that is right.
Perfect. So that is it on today's show. Thank you so much, Brenda, for that brief. We've not been able to just go through what exactly we have done for today's show. But of course, if you're there and you'd love to get into details what we've talked about today, we've been live on Facebook and YouTube, that is MBCI TV official YouTube page on YouTube and MBCI TV on Facebook. So go through the whole show right from the beginning and you'll be able to get every single detail of what we've talked about today. That will be of help to you, and you can also, please do, share the link with your friends, with your family, and they'll be able to just, get to know what infertility is and how to go about it, where you can get help, because that's very important, okay? But thank you so much for being here for today's show. God bless you. God be with you. Of course, this is our prayer festival week, so that tells you that we'll be having the lunch hours, we'll be having, of course, on Friday, the Kesha and the Morning Glory from 5 a.m. each and every other day. That will be a blessing to you, sana, sana, sana. So that is it for today's show. Thank you so much for being here. Of course, tukimalizia tutakuwa tunamalizia na Did You Know. Brenda, just stay right there. Today you'll be reading the Did You Know for us, so that we get to just changamsha ourselves kidogo after a whole very intense discussion today. So let's get the Did You Know segment. Okay. Brenda?
Did you know that sitting too long can be as harmful as smoking?
Huh?
Yeah.
Okay. Did you know that?
I actually had. I have read somewhere that sitting for too long can build up gases, especially when you eat and don't take a walk. So it can cause indigestion. But I didn't know that it's harmful as smoking.
Dr. Brenda. Doc, is that true? What did you say about it? Is sitting for too long that dangerous? Or that harmful?
Sitting for too long in one position without walking around and all that can be harmful, in that it puts you even at risk of developing a blood clot.
Blood clot?
Yeah, that's even a more serious harm.
Yeah.
You can develop a blood clot usually in your lower limbs, and that can be quite a bit dangerous.
Serious.
Yeah,
that's very serious.
So if you are on a long flight and all that, you are always encouraged to take breaks and walk around and all that. If you sit throughout for too long, you are at risk of a blood clot, especially if you have other risk factors for forming a blood clot.
Okay. I think also this goes to the 8 to 5s, the people usually in the office. Yeah, just make sure that you take walks kidogo after like how long of sitting?
Well, we don't have a very prescribed, duration that sit for 2 minutes and work
and
for
then
5.
work for
But just make sure you take in, for example, if your job is 8 to 5, make sure like during tea break you walk around and pick your own tea. Don't just sit and let someone get the tea for you. Just walk around and get it. Walk around for lunch. Walk around and consult our colleagues instead of calling them through intercom.
Okay, I hear you. Perfect. Naona kuna watu wameanza kuangaliana na side eyes. Watakutuma na leta maji, please get to
huyo ni mbugua. Wacha ni mwanike ole. Mbugua, go for those walks.
All right, so that is it. Thank you so much for tuning in. Thank you for being here. We've been here from 7:35, where we started with music up to around 8, and then we got into the discussion, and I know that that has been a blessing to you. Have an amazing, amazing rest of the day. For this particular show, we'll meet you next week on Wednesday, same time, same place. Do not miss out. We're going to have an amazing, amazing, amazing discussion next week. Until then, God bless you. God be with you. Have an amazing rest of the day. God bless you. Bye-bye.